Welcome, curious minds. Today, we're doing a deep dive into a health debate that honestly might surprise you. It comes straight from Professor Lin's recent article. We're asking, is a low salt diet actually bad for your health? I mean, you hear so much conflicting advice, right?
Yes.
So today, we want to unpack the science behind this and really help you get the tools to think critically about these kinds of health claims.
Absolutely. And Professor Lin, well, he jumps right in, tackling this claim that low-salt diets are harmful.
Hmm.
He doesn't mince words either. He suggests this idea, this myth, could actually be dangerous, even fatal, in terms of public health impact.
Wow, okay, fatal. That's strong. And it's not just some obscure academic debate, is it? There are people actively arguing we should eat more salt.
That's right. You've got researchers like James DeNichol-Nonio, for instance. He published a book back in 2017, The Salt Fix, really pushing for higher salt intake. And more recently, a 2023 paper looking at, I think it was 23 trials, arguing sodium restriction might cause insulin resistance.
Okay, so he's building a case there, quite the counter-narrative. And then there was that big meta-analysis in 2014, the one finding that both very low and very high sodium seemed linked to higher mortality.
Exactly. That one definitely caused a stir. It made things seem, well, confusing for people.
Right. So from the outside, it looks like scientists just can't agree. What's the pushback? What issues do Professor Lin and others, like Lawrence Apple at Johns Hopkins, have with these studies?
Well, Appel looked at the same evidence and basically said there's no reliable evidence that low sodium itself is harmful. And this is where Professor Lin's critique is so important. He points to fundamental problems in how those studies were done.
Okay, let's unpack this. This is the critical thinking part. Professor Lin highlights two main methodological flaws, right? Let's start with the first one, measuring salt intake.
Yes, exactly. Measurement mayhem, as you called it. It sounds simple, but accurately figuring out someone's long-term habitual sodium intake is surprisingly difficult.
How so? Don't they just measure it in urine?
They do, often with a 24-hour urine collection. But the problem is, one single 24-hour sample. It doesn't really tell you someone's average intake over weeks or months. Our sodium levels fluctuate a lot day to day.
Ah, okay. So one day doesn't represent the norm.
Right. And spot urine samples, even less accurate for estimating usual intake. So if your measurement of the exposure, the salt intake, is unreliable, then any link you find to health outcomes is, well, shaky at best.
Got it. So bad measurements is flaw number one. What's the second one? This sounded really interesting. Reverse causality.
Yes, this is crucial. Many of these studies included people who already had conditions like heart disease or diabetes.
Okay.
And these are exactly the people who are often told by their doctors to cut back on salt because they're already sick.
Ah, I see where this is going.
So their low sodium intake wasn't causing their higher risk of death. Their pre-existing illness was causing both a higher risk and leading them to eat less salt.
So the cause and effect were flipped.
Completely flipped. It's a classic trap in observational research. It looks like a low salt is bad, but really being sick is bad. And sick people are told to eat less salt.
That makes so much sense. It's like blaming crutches for someone having a broken leg.
Exactly that. And Professor Lin really hammers this point home. Which brings us back to the more accepted view, based on studies that did manage these issues better. Like that 2014 Harvard and Johns Hopkins study. They used better methods, larger groups of healthier people, and found that reducing sodium, down to maybe 1,500 to 2,300 milligrams a day, is generally beneficial. That aligns with current guidelines.
So pulling this all together, what's the real-world takeaway here? Why does busting this myth matter so much?
Well, think about the scale. The World Health Organization estimated in 2023 that reducing global salt intake could save around 7 million lives by 2030.
7 million. Wow.
Yeah. So when Professor Lin calls the low salt is harmful idea fatal, he means it undermines public health efforts that could literally save millions. Promoting that idea could actively cause harm by stopping people from making a potentially life-saving change.
That really puts it into perspective. It highlights just how vital critical thinking is when we're faced with health news, especially when claims seem contradictory or go against established advice. So maybe the final thought for you, our listeners, is this. In this flood of information we all live in, how can you consistently check the validity of health advice? And maybe more importantly, which sources can you really trust to guide your choices? Something to think about.